Lumbar disc herniation is when a portion of the cartilaginous discs between two of the bones of the spine protrudes. This happens to many people during the course of their life, particularly in young patients. Usually, lumbar disc herniations cause pain. Initially, they'll cause pain in the back. If the disc pushes on the nerve, it will cause pain that runs down the leg. This is called sciatica. Most episodes of lumbar disc herniation settle without the need for surgery. In a small percentage of cases, the disc protrusions are large and cause severe compression of the nerve. These are patients who generally need surgery rapidly. Most episodes of lumbar disc herniation settle within 6 to 12 weeks. The symptoms of lumbar disc herniation are usually acute back pain. The pain is usually localised in the lumbosacral area but can radiate towards the buttocks. If the nerve is involved, the pain will radiate down the leg, and this can run down the back of the leg, the side of the leg, or the front of the leg. In severe cases, the pain will reach the ankle and even cause numbness and weakness of the foot. These are the types of patients who will need surgery generally rapidly. In most cases, if lumbar disc herniations are left untreated, they will gradually improve. The disc material tends to shrink down and be slowly reabsorbed by the body. Hence, the pain will be initially quite intense, but then settles over the course of some weeks. During this period, local treatments with massage, physiotherapy, chiropractic and osteo treatments can help significantly with the muscle spasm. They can also help give significant improvements with exercise, if this is not causing severe pain. Over time, the disc resorbs and the symptoms improve. And in most cases, 90% or more, patients do not require surgery. Medication can also be used to alleviate the pain. Standard anti-inflammatories are used often, and these help significantly. Stronger analgesics, such as narcotic analgesics, are used for severe cases. Often, patients will also respond to oral corticosteroid tablets, and these can be given in a short course, generally for 3 days, and often bring dramatic relief. In some cases, a cortisone injection is used. This is placing a needle under CT guidance into the spine, into the area of the disc protrusion. And this can give a large volume of cortisone into the area of the disc prolapse. These injections are performed by radiologists under a CT scan guidance. If the symptoms do not respond to the conservative treatments, then surgical treatment is an option. Surgical options in the management of lumbar disc protrusion are minimally invasive procedures down a little incision to remove the portion of disc that is pushing on the nerve. These are highly effective, safe and very common procedures to perform. The surgery normally takes about 1.5 hours. It is performed through a little incision in the midline of the spine at the back of the body. Patients require a general anaesthetic and they are positioned face down for the surgery. The surgery involves going down a small access canal or tunnel to remove the material that is pushing on the nerve, and usually patients awake from the surgery without their pain down the leg. The surgery is highly effective and very safe. Occasionally, some patients with recurrent disc protrusion or more severe symptoms may require more extensive surgery, but this is not usual for standard lumbar disc prolapse. Patients who have surgery for lumbar disc prolapse usually remain in the hospital 1 or 2 nights. Patients can go home the same day, but I don't recommend it. Normally there will be some wound discomfort just from the disturbance of the surgery, and this is best treated by 1 or 2 days of resting. Patients can then go home, and I usually recommend to have a week to 10 days of having home convalescence. Day-to-day activities can be done, but no strenuous activity needs to be performed during this time. Patients gradually return to their normal activities over 3, 4, 5, 6 weeks, returning to normal gym work and exercise program at the 6-week mark. In most cases from lumbar disc prolapse, patients are able to return to their normal life and their normal exercise program. The 90% of patients who don't require surgery generally will be able to return to their normal activities very quickly. For patients who do, which is around 10% of patients, They will need to take a small period of time convalescing from the surgery, i.e. 2 to 3 to 4 weeks, but can return to their normal activities at 6 weeks. I advise all patients not to do heavy, strenuous activity for 2 to 3 months after surgery, but one can return to all normal activities. If patients have back pain and feel that they have sustained a significant lumbar disc herniation, the best investigation is a CT scan initially and subsequently a lumbar MRI scan if the symptoms don't resolve within 2 to 3 weeks. If you feel you have sustained a significant lumbar disc herniation, you should obtain an MRI scan of the lumbar spine. If you need to have the lumbar MRI scan organised, please contact my office on the contact details of the website.